Chapter 1. Ordinary Morning. Katherine Morris stirred awake in her downtown Austin apartment as the morning sun filtered through the Venetian blinds, casting geometric shadows across her cluttered desk, where art supplies and design sketches lay scattered from late-night work sessions. The 28-year-old graphic designer had planned to spend this particular Saturday in October 2019 putting the finishing touches on her passion project, a series of whimsical illustrations for a children's book about a young girl who discovers magical creatures in her backyard garden. She had been working on this personal endeavor for months, stealing hours between client deadlines at the small advertising agency where she had worked for the past 3 years. As she padded barefoot to the kitchen of her one-bedroom apartment, Katherine noticed a familiar dull ache behind her temples, the same persistent headache that had been plaguing her for weeks. She attributed it to the stress of juggling multiple projects at work, including a particularly demanding campaign for a local restaurant chain that required long hours and multiple revisions. The headaches were accompanied by occasional dizzy spells and moments when her vision seemed slightly blurred, but she dismissed these symptoms as consequences of too much screen time and too little sleep. Katherine prepared her morning coffee using the French press her mother had given her years ago, one of the few possessions she had kept after her mother's death from breast cancer 5 years earlier. The loss had created a chasm between Katherine and her father, Richard Morris, that neither seemed able to bridge despite their mutual grief. Richard, a 60-year-old mechanic who had recently retired after 35 years at the same auto shop, had always approached life with stoic pragmatism, viewing emotional expression or health complaints as signs of weakness that needed to be overcome through sheer willpower. While sipping her coffee, Katherine scrolled through her phone, checking social media updates and responding to messages from friends. She had promised to visit her father that afternoon to help him organize some of her mother's belongings that still remained boxed in the spare bedroom. It was a task they had both avoided for years, but with Richard's recent retirement giving him more time to confront the remnants of his wife's life, he had finally asked Katherine for help. She dreaded the emotional weight of sorting through her mother's clothes, jewelry, and personal items, knowing it would likely trigger another tense conversation about grief, memory, and their strained relationship. The apartment fell silent, except for the distant hum of traffic on South Lamar Boulevard and the occasional bark of a neighbor's dog. Katherine reviewed her sketches from the previous night, making mental notes about color choices and composition adjustments she wanted to implement. Her artistic style had evolved over the years, from the realistic portraits she had favored in art school to more stylized, emotionally expressive illustrations that seemed to capture something deeper about human experience. Working on the children's book felt like a return to the pure joy of creation she had felt as a child, before the practical demands of making a living had channeled her creativity into marketing materials and corporate branding. As she prepared to shower and dress for the day, Katherine felt another wave of dizziness wash over her, causing her to grip the bathroom doorframe for stability. She stood still for a moment, waiting for the sensation to pass, then continued with her routine. The symptoms had become so routine over the past month that she had developed strategies for managing them, moving more slowly when standing up, taking breaks from computer work more frequently, drinking more water throughout the day. It never occurred to her that these seemingly minor inconveniences might be warning signs of something far more serious brewing in her brain. Chapter 2. First Signs. Katherine arrived at her father's suburban home in Cedar Park just after noon, parking her Honda Civic behind Richard's pickup truck in the driveway of the modest ranch-style house where she had grown up. The property looked exactly as it had for decades, with its well-maintained lawn, mature oak trees, and the detached garage where Richard spent most of his time working on various mechanical projects. The familiarity of the setting brought back a flood of childhood memories. Summer afternoons spent reading in the shade of the oak trees while her father tinkered with engines, family barbecues where her mother's laughter filled the backyard, quiet evenings when the three of them watched television together in comfortable companionship. Richard emerged from the garage wearing his usual weekend uniform of faded jeans and a work shirt stained with motor oil, his graying hair disheveled from hours of focused concentration. He was in the middle of restoring a 1985 Harley-Davidson Sportster that he had purchased 6 months earlier, a retirement project that had consumed most of his free time and provided a welcome distraction from the emptiness of the house. The motorcycle represented something tangible he could fix, unlike the emotional wounds that had never seemed to heal properly after his wife's death. Katherine followed her father into the garage, where tools were arranged with military precision along workbenches that held decades of accumulated automotive knowledge. The smell of motor oil, metal polish, and old leather filled the space, creating an olfactory time capsule that transported her back to childhood visits, when her father would patiently explain how engines worked, while she pretended to understand his mechanical wisdom. Now, as an adult, she appreciated the meditative quality of his work, the way complex problems could be solved through methodical troubleshooting and the application of practical skills. As they talked about the motorcycle restoration and Katherine's work projects, she began to notice that her words were coming out slightly slurred, as if her tongue had grown thick and unwieldy. She paused mid-sentence, touching her lips with her fingertips, surprised by the strange sensation. The headache that had been lurking in the background all morning suddenly intensified, becoming a sharp, focused pain behind her left eye that made her squint involuntarily. She tried to continue the conversation, asking about her father's retirement plans and his adjustment to life without the daily routine of the auto shop. The pain in her head escalated rapidly, from uncomfortable to excruciating, accompanied by a peculiar visual disturbance that made everything appear doubled, as if she were looking through a broken prism. Katherine attempted to tell her father about these alarming symptoms, but the words that emerged from her mouth were garbled and incomprehensible, even to her own ears. Panic began to rise in her chest as she realized something was terribly wrong with her body's most basic functions. Her right hand, which had been holding a cup of coffee, suddenly felt disconnected from her conscious control, fingers loosening their grip without her permission. The ceramic mug fell to the concrete floor with a sharp crash that echoed through the garage, sending hot liquid and pottery shards across Richard's carefully swept workspace. The sound startled both father and daughter, but for different reasons. Richard was annoyed by the mess and potential damage to his tools, while Katherine was horrified by her complete inability to prevent the accident. When Richard turned around to assess the damage, he saw his daughter standing motionless with her mouth moving soundlessly, her face beginning to droop asymmetrically in a way that made her appear as though she were melting. Katherine's right arm hung uselessly at her side, while her left hand frantically gestured toward her face, trying to communicate the terrifying realization that half of her body had stopped responding to her commands. Time seemed to slow down as she experienced the strange sensation of being trapped inside a body that was systematically betraying her, each passing second bringing new losses of function and control. Chapter 3. Denial. Richard's first instinct upon witnessing his daughter's distressed state was skepticism rather than alarm, a response shaped by decades of viewing emotional displays with suspicion and attributing physical complaints to psychological weakness. He approached Katherine with the measured patience of someone accustomed to dealing with what he perceived as dramatic overreactions, his expression conveying more irritation than concern, as he surveyed the broken coffee cup and the puddle spreading across his garage floor. His immediate assumption was that Katherine was experiencing some sort of anxiety attack or stress response related to their planned task of sorting through her mother's belongings, a chore he knew she had been dreading. Katherine's attempts to communicate her deteriorating condition became increasingly desperate as her speech centers continued to malfunction, producing sounds that bore no resemblance to coherent language. She pointed repeatedly at her face, trying to demonstrate the obvious asymmetry that was becoming more pronounced with each passing minute. But Richard interpreted her gestures as theatrical expressions of emotional distress rather than urgent medical symptoms. His lifetime of suppressing his own vulnerabilities had created a blind spot that prevented him from recognizing genuine physical crisis when it presented itself in ways that didn't conform to his expectations. The mechanic in Richard searched for logical explanations that fit his worldview, suggesting that Katherine might be dehydrated, overtired from working too many late nights, or simply overwhelmed by the prospect of dealing with painful memories associated with her mother's possessions. He offered practical solutions: a glass of water, a chance to sit down and rest, perhaps postponing their planned activity until she felt better. Each suggestion was delivered with the gruff kindness of a man who believed that most problems could be solved through common sense and determination, if people would just stop making such a fuss about minor discomforts. Katherine's coordination began to fail more dramatically as the stroke progressed, her sense of balance deteriorating until she could no longer maintain an upright position. She sank to her knees on the garage floor among the coffee-stained concrete and broken ceramic, her right leg refusing to support her weight, while her left side struggled to compensate for the growing paralysis. Even this obvious physical collapse failed to convince Richard that his daughter was experiencing a medical emergency rather than an emotional breakdown, his ingrained skepticism preventing him from recognizing the clinical signs of a catastrophic neurological event. 9 million brain cells in Katherine's oxygen-starved neural tissue. She could feel her consciousness narrowing, her ability to process information becoming increasingly limited as the blockage in her middle cerebral artery prevented blood from reaching vital areas of her brain, responsible for speech, movement, and cognition. The young woman who had awakened that morning with plans to work on her art and spend time with her father was disappearing neuron by neuron, while Richard continued to interpret her condition through the lens of his own emotional limitations. Katherine's panic was compounded by her growing awareness that she was completely unable to make her father understand the severity of her situation, trapped in a body that could no longer perform the basic functions of communication and movement that she had taken for granted her entire life. She watched Richard's face for signs that he was beginning to grasp the reality of her condition, but saw only the familiar expression of frustrated patience that had characterized so many of their interactions over the years, particularly since her mother's death had stripped away the buffer that had helped them navigate their complicated relationship. As her speech disappeared entirely and her right side became completely unresponsive, Katherine experienced the terrible isolation of being fully conscious while imprisoned in a body that had become a stranger to her. She could think and feel and remember, but she could not act or speak or move in ways that would allow her to connect with the outside world. The garage around her began to seem distant and dreamlike, sounds becoming muffled and colors fading as her compromised brain struggled to process sensory information through damaged neural pathways. Chapter 4. Recognition. Deborah Hamilton's unexpected arrival at Richard's house occurred at the precise moment when Katherine's condition had deteriorated beyond any possibility of being dismissed as emotional distress or simple fatigue. The 65-year-old retired registered nurse had worked for 30 years in the emergency department of Austin's Del Seaton Medical Center, where she had seen countless stroke victims and had developed an almost intuitive ability to recognize the telltale signs of cerebral vascular accidents. She had stopped by to return a socket wrench set she had borrowed 2 weeks earlier when her own car had needed emergency repairs, intending to make only a brief social call before continuing with her Saturday afternoon errands. The moment Deborah entered the garage and saw Katherine's condition, her medical training immediately activated, overriding any social pleasantries or explanations about her unexpected visit. She quickly assessed the classic stroke presentation, the asymmetrical facial drooping that gave Katherine's expression a lopsided appearance, the slurred and incomprehensible attempts at speech, and the obvious weakness affecting the entire right side of her body. Years of emergency medicine experience had taught her to recognize these symptoms, even in situations where they were unexpected, and she knew that every minute of delay would result in permanent brain damage. Without pausing to explain her actions to the confused Richard, Deborah immediately pulled her cell phone from her purse and dialed 911, her voice calm but urgent as she provided the emergency dispatcher with essential information about Katherine's symptoms, age, and current condition. She rattled off medical terminology with the precision of someone accustomed to communicating complex information quickly and accurately, describing the presentation as a probable acute cerebrovascular accident requiring immediate transport to the nearest stroke center for emergency intervention. While maintaining her phone conversation with emergency services, Deborah knelt beside Katherine and began conducting a rapid neurological assessment, checking pupil response, testing basic reflexes, and monitoring vital signs with the systematic thoroughness that had become second nature during her decades in emergency medicine. She spoke to Katherine in the calm, reassuring tone she had perfected for frightened patients, explaining what she was doing and providing the kind of professional reassurance that helped maintain cognitive function, even as the stroke continued its destructive progress through brain tissue. Richard watched this transformation of his casual neighbor into a medical professional, with growing bewilderment and dawning horror, as the implications of Deborah's urgent response began to penetrate his consciousness. The reality of his daughter's condition hit him like a physical blow, as he realized that his stubborn refusal to take her symptoms seriously had cost them precious time that could never be recovered. The guilt was immediate and overwhelming, a crushing weight that settled in his chest as he understood that his skepticism and emotional rigidity had potentially compromised Katherine's chances of recovery. Deborah's efficient medical interventions continued as she positioned Katherine to protect her airway, monitored her breathing pattern, and checked her pulse rate while providing continuous updates to the emergency dispatcher about changes in the patient's condition. Her professional demeanor masked her own concern about the delay in calling for help, knowing that the therapeutic window for stroke treatment was measured in hours, and that even small delays could mean the difference between full recovery and permanent disability. She kept these worries to herself, while focusing on the immediate tasks of stabilization and preparation for transport. Katherine remained conscious throughout this medical emergency, fully aware of the transition from her father's dismissive skepticism to Deborah's professional urgency, understanding that her worst fears about her condition were being confirmed by someone with the expertise to recognize the gravity of her situation. The validation was simultaneously terrifying and relieving, knowing that finally someone understood what was happening to her brain, even as she remained trapped in her failing body, unable to participate in the medical decisions that would determine her future. The garage that had been a peaceful workspace filled with familiar mechanical projects was transformed into an impromptu emergency medical facility, with Deborah's calm professional presence providing a stark contrast to Richard's growing panic, as he finally grasped the life-threatening nature of his daughter's condition. Time stretched and compressed in the surreal way that medical emergencies distort normal perception, each minute feeling simultaneously eternal and fleeting, as they waited for the ambulance that would begin Katherine's journey toward either recovery or permanent disability. Chapter 5. Fight for Life. The ambulance arrived at Richard's house with sirens wailing and emergency lights painting the quiet suburban neighborhood in alternating patterns of red and blue, transforming the peaceful Saturday afternoon into a scene of medical urgency that drew curious neighbors to their windows and front porches. The paramedics who emerged from the vehicle moved with practiced efficiency, their equipment-laden uniforms and serious expressions immediately establishing the gravity of the situation as they quickly assessed Katherine's condition and confirmed Deborah's preliminary diagnosis of acute stroke requiring immediate hospital intervention. Lead paramedic Jake Morrison, a 15-year veteran of emergency medical services, took charge of the scene with calm authority, while his partner Sarah Chen prepared the gurney and advanced life support equipment that would be needed for transport. Morrison's initial assessment confirmed the classic presentation of a left hemisphere stroke affecting the middle cerebral artery, with Katherine showing clear signs of right-sided hemiplegia, expressive aphasia, and altered level of consciousness that indicated significant brain tissue damage was already occurring, despite her relatively young age. The paramedics worked systematically through their stroke protocol, establishing intravenous access for medication administration, monitoring cardiac rhythm for potential complications, and conducting a rapid neurological assessment using standardized scales that would help emergency department physicians determine the most appropriate treatment approach upon arrival. They communicated continuously with the receiving hospital via radio, providing detailed patient information that would allow the stroke team to prepare for immediate intervention, while the ambulance raced through Austin traffic toward Del Seaton Medical Center. Katherine's transport to the hospital became a carefully choreographed medical procedure as the ambulance navigated city streets with emergency priority, Sarah monitoring vital signs and neurological status, while Jake coordinated with hospital personnel about expected arrival time and patient condition. The advanced life support protocols included oxygen supplementation to maximize brain tissue oxygenation, careful blood pressure management to maintain cerebral perfusion without exacerbating potential bleeding, and continuous assessment for signs of deteriorating neurological function that might require additional interventions. Upon arrival at the medical center, Katherine was immediately transferred to the emergency department's stroke bay, where a multidisciplinary team of physicians, nurses, and technologists had assembled to begin the time-critical evaluation process that would determine her treatment options. Dr. Michael Rodriguez, the attending neurologist, conducted a rapid but thorough examination while simultaneously reviewing the paramedics' field assessment and Katherine's brief medical history provided by Richard, who had followed the ambulance in his pickup truck, with Deborah accompanying him for moral support. The emergency department moved with clockwork precision as Katherine underwent immediate diagnostic imaging, including computerized tomography, to rule out hemorrhagic stroke and determine the extent of ischemic brain tissue damage. The CT angiogram revealed the suspected blockage in her left middle cerebral artery, confirming the need for immediate thrombolytic therapy if she was to have any chance of meaningful neurological recovery. Dr. Rodriguez explained to Richard that they were within the narrow therapeutic window for tissue plasminogen activator administration, but warned that the delay in seeking medical attention had significantly reduced the likelihood of complete functional recovery. The decision to proceed with thrombolytic therapy carried substantial risks, including the possibility of converting an ischemic stroke into a potentially fatal hemorrhagic stroke, but represented Katherine's only realistic hope for dissolving the blood clot that was systematically destroying her brain tissue. The medication was administered intravenously while Katherine was monitored in the intensive care unit, with continuous neurological assessments to detect any signs of improvement or dangerous complications that might require emergency surgical intervention. Richard spent the next 48 hours in the hospital waiting area, alternating between pacing the corridors and sitting in uncomfortable plastic chairs while wrestling with guilt over his delayed recognition of Katherine's symptoms and fear about her uncertain prognosis. Deborah remained with him during much of this vigil, providing both practical support and professional perspective about stroke recovery possibilities, while helping him navigate the complex medical information being provided by the treatment team. The next 2 days would be critical in determining whether the thrombolytic therapy had been successful in restoring blood flow to Katherine's brain, and how much permanent damage had occurred during the hours when her neural tissue was deprived of oxygen. Chapter 6. New Beginning. Katherine's gradual emergence from the acute phase of her stroke began on the 3rd day after her admission, when she demonstrated the first clear signs of neurological improvement by responding appropriately to simple verbal commands and showing increased awareness of her surroundings. The intensive care unit staff had maintained continuous monitoring throughout the critical period, watching for signs of either recovery or complications that might indicate the thrombolytic therapy had been unsuccessful or had caused dangerous bleeding within her brain tissue. Dr. Rodriguez's morning examination revealed cautious reasons for optimism as Katherine showed partial restoration of speech function, though her words remained slurred and difficult to understand, and some voluntary movement had returned to her right arm and leg, though significant weakness persisted throughout the affected side of her body. The neurologist explained to Richard that while Katherine had avoided the worst possible outcomes of massive stroke, she faced months of intensive rehabilitation to regain as much function as possible from the brain tissue that had survived the ischemic insult. The rehabilitation process began immediately with physical therapy assessments to determine the extent of motor function loss and develop strategies for relearning basic movement patterns that had been disrupted by the stroke. Katherine's right-sided weakness required her to essentially retrain her brain to communicate with muscles that had lost their normal neural connections, a process that would demand enormous patience and determination from both patient and therapy staff as they worked to rebuild pathways that had been established since early childhood. Speech therapy sessions focused on addressing Katherine's expressive aphasia, helping her relearn how to form words clearly and communicate complex thoughts that her intact cognition could formulate, but her damaged language centers struggled to express verbally. The speech-language pathologist worked with Katherine on exercises designed to strengthen the oral muscles affected by the stroke, while simultaneously retraining the neural pathways responsible for coordinating the complex sequence of movements required for normal speech production. Occupational therapy addressed the practical challenges Katherine would face in returning to her career as a graphic designer, focusing particularly on fine motor control in her dominant right hand that was essential for drawing, computer work, and the detailed manipulations required for artistic creation. The occupational therapist introduced adaptive techniques and assistive technologies that might help compensate for permanent deficits, while maximizing Katherine's ability to perform the professional tasks that gave meaning and purpose to her life. Richard's relationship with his daughter underwent a profound transformation during these weeks of rehabilitation, as he witnessed her daily struggles to remaster basic functions he had always taken for granted. His presence in the hospital became a constant source of support, rather than the dutiful obligation he had initially felt, as he gradually understood that his daughter's recovery would require emotional connection and encouragement, rather than the stoic independence he had always valued. The guilt over his initial dismissal of her symptoms evolved into a deeper commitment to being present for her journey toward whatever level of recovery proved possible. The conversations between father and daughter during this period addressed not only the practical aspects of Katherine's medical care, but also the fundamental issues that had strained their relationship since her mother's death. Richard's acknowledgement of his mistakes in recognizing her stroke symptoms opened a broader discussion about his difficulty expressing emotions and providing the kind of support that Katherine needed during times of vulnerability and crisis. This emotional breakthrough proved as important for Katherine's psychological recovery as the medical interventions were for her physical rehabilitation. 6 months after her stroke, Katherine had achieved sufficient recovery to return to work on a modified schedule that accommodated her ongoing therapy appointments and the fatigue that remained a persistent consequence of her brain injury. Her speech, while still occasionally halting, had improved dramatically, and she had regained enough fine motor control to resume her graphic design work, though complex projects required more time and patience than before her stroke. The children's book illustrations she had been working on the morning of her stroke became a powerful symbol of resilience as she completed the project using adaptive techniques that worked around her residual deficits. Katherine's experience as a stroke survivor at an unusually young age led her to become an advocate for stroke awareness, particularly focusing on the importance of recognizing symptoms quickly and seeking immediate medical attention, rather than dismissing warning signs as minor health complaints. She began speaking at community health fairs, medical conferences, and support groups, sharing her story to help others understand that strokes could affect people of any age, and that rapid response was crucial for optimal outcomes. Richard joined these advocacy efforts, candidly discussing his role in delaying treatment and the lessons he had learned about taking health symptoms seriously, regardless of his preconceptions about their likely significance. The father-daughter relationship that had been damaged by grief and complicated by different approaches to emotional expression was rebuilt on a foundation of mutual respect, honest communication, and shared commitment to Katherine's continued recovery and their advocacy work together. Richard's retirement years found new purpose in supporting stroke survivors and their families, while Katherine's artistic work increasingly incorporated themes of resilience, recovery, and the importance of family connections in overcoming life's most challenging obstacles.